All right, I am washing my hands. Knock, knock. Hi, my name is Angela. I'm the nurse practitioner student today. How are you feeling?
I'm all right. How are you?
I'm good. The patient is awake, alert, and oriented times 4. The patient is showing no signs of distress, and hygiene is good. Patient is well groomed. Posture is upright, and there are no signs of odd motor dysfunction happening. And the patient's facial expression is normal. Do you mind just telling me your height and your weight for me, please?
6'4", 290 pounds.
All right, perfect. I just need to get a temperature on you, okay? Is it okay if we just put this underneath your tongue real quick? Thank you. Thank you. Are you okay to hold that? Thank you. Try to make sure in this tube. While the patient was taking temperature, I checked respirations for 30 seconds. Patient was breathing, and then times by 2, patient was breathing 19 breaths a minute, which is normal. All right, temperature is 98.5, which is great. I'm just going to check your pulse real quick if you don't mind. I'm just checking with the radial artery. All right, so I got 30 for 15 seconds. So 30 times 2 is 60. So the patient is a little tachycardic right now. His heart rate is 120, but it is normal besides that. I am going to get your blood pressure if you don't mind. I just have to make sure that the cuff is fitting appropriately. Sorry. All right. The cuff seems to fit appropriately. I am just going to have to put this right here. I'm going to sit next to you if you don't mind. And just do me a favor, can you just relax your arm? I have to I'm just testing to make sure that we get the correct All right, I do not feel a pulse after 120, so I am going to I'm going to put the cuff all the way up to, I'm going to put the cuff all the way up to 120, 30, 150 while we're taking blood pressure. I'm just going to be listening at the brachial artery. I'm going to put the cuff up all the way to 150. Sorry. I got 130 over 90. And because you're a new patient, we're gonna do it in both arms, okay? Sorry about that. I'm gonna just switch over to your other side, okay? And we're just gonna do the same thing again over here. All right. Again, free of clothing. The cuff fits good on the arm. And then I'm also just going to, again, palpate using the radial artery to make sure that our reading is accurate. All right, this one I feel it stop at 160, so I'm gonna go up to 190 this time. All right, this arm was a little higher at 140 over 98. And then if you don't mind, I'm just gonna give you a minute. I want to do a standing. So what we do is sometimes what we call orthostatics. Sometimes your blood pressure can end up changing from when you get up, and sometimes that's why people start feeling like dizzy and stuff like that. So in a second, I'm gonna have you stand up, and we're just gonna take your blood pressure again, just to check your orthostatics and just making sure that it doesn't go down, okay? So just relax for a second, and then we'll do that. The patient doesn't have any foul odors, especially, and no foul odors coming from their breath as well. Very good hygiene and all that kind of stuff. Usually we wait about like 3 minutes or so for us to do this. I don't know if I have to wait 3 minutes, but is it okay if I just have you stand up? We're just gonna say that we waited 3 minutes. All right. And I'm just gonna check the patient's blood pressure. Again. And because I already palpated everything, I'm just gonna try one more time. I'm gonna blow up to 160. All right, 120. 120 over 92. All right. The patient's overall is great. Do you have any questions?
Cool.
All right, thank you.